So we look at the practical work around tennis elbow. Remember, we've already done that hand and the detailed arm work. So if you've not done that already, come back to do that first, because this is what we're adding to the treatment. This is the one you'll remember we said where we're going to work 3 of the client's finger width below the elbow. So I'm going to ask Gordon to place his hands there just so I get the marker. The reason we use the client's fingers, if you see my fingers against Gordon's, I'll be working in the wrong place. I'll be working higher up, but I need to work at the bottom of the 3 of his finger widths. Thank you, Gordon. And we're working with static pressure all the way around. You'll find some places you press, there's not much resistance. You can move on from them. Other places you press, you'll suddenly find that there's resistance there, and your client will report, ow, that's tender. They're the spots that you need to work. So that's where the muscle's been kind of held. That's where the tension is there in the muscle. So we need to move them. And it's just static pressure. The key thing is you're moving all the way around that bend, all the way around that line. So we're working right round. This is another tight spot there. And I can just feel the resistance. So where there's no tension in the muscle, the muscle, you can kind of press into it and there's no great resistance. When you hit one of those really tight spots, the muscle kind of pushes you off. It really fights back. And that's what you're just holding. And you're just holding that until it releases. Now, as you become more familiar with the hand and arm work, you won't need to do this as a separate thing. You'll just be able to integrate it. So you'll have done the hand work, you'll come up the arm. As you get to here, you'll suddenly find that tight spot. And you won't need the 3 finger widths anymore because the muscles will tell you. But just to begin with, do that client 3 finger width. We're then going to do the same at the top of the arm. So again, I'm going to ask Gordon to, starting here right in the elbow crease, to put his 3 finger widths. And I'm working just above that. Thank you. And again, instantly, I can feel that resistance there in the muscle. You can see it. See that muscle pinging under my touch. So I'm just going to hold that. Now we can integrate this, as we said, with the general arm work. So if it's not releasing after a minute or 2, go back, do some more arm work and then come back to it. Do some more arm work and then come back to it. Just keep coming back to it until it releases. But each time, hold it for a good minute in between. You're working all the way around. Be careful on the inner arm. Use less pressure on the inner arm because this is an area that will bruise, particularly in women. You can use your finger if that's easier to get to. You can get clever and you can use 2 spots at once. So you can do your finger at the back and the thumb at the front if your client's happy with that. So you're kind of gripping either side. Integrate it in with that arm work and you'll find that that will give the relief in the elbow, because we can't work, remember, on the elbow itself because we've got inflammation there, which is why we're working above and below.